But the most common cancers in children are the leukemias, followed, of course, by the lymphomas and by the CNS tumors, and then closely followed by many other sort of cancers. The mother will see some alteration, bring the child. She'll find a lump in the abdomen, bring the child. So actually the mother is the one who examines the child daily. So she's the only one who can see for early signs and bring the child.
Hi guys, this is Mini Devan and you're watching TheHealthSite.com. On the occasion of International Childhood Cancer Day, today we have with us Dr. Anuradha Murthy. Hi doctor, how are you?
Hi, it's wonderful to be here with you. Thank you.
Thank you so much for joining us today. It's so good to see you. And since it's International Childhood Cancer Day, the very first question that comes to my mind right now is if you could enlighten our audiences with the fact that what are the most common types of cancers in children?
It's a very important and pertinent question. Now, children are a very, very amazing kind of group of patients. Childhood cancers are very, they are frequently encountered in global studies. We don't have a full fix of their absolute, weightage. But the most common cancers in children are the leukemias, followed, of course, by the lymphomas and by the CNS tumors, and then closely followed by many other sort of cancers. Now, the reasons are that they rapidly have the cell turnover, and the mystery is from a single cell, the entire human body is developed. So as they are developing, these genetic breaks occur to cause the cancer. But leukemias form the bulk, about 28 to 30%.
And if we talk about the major causes of childhood cancers, what will it be?
I think it would be the rapid turnover for development. And because they are developing, there are gene breakdowns. So there are two forms of what causes it. I think definitely it is rapid turnover of cells and some genetic mishaps. But of course, there is a small group of cancers which could be genetic in origin from the mother or the father.
And if we talk about the early signs and symptoms of identifying such types of cancer, specifically leukemia, since we're talking that this is perhaps the most commonly observed cancer in children, what will it be?
The mother is actually the best keeper of her child. So most of them present with the mother saying the child is weak, or the child has bleeding gums, or the child is listless, and they come to their general physician, their general pediatrician, who will then carry a battery of tests, find out what is wrong, and then the next steps.
Also, I assume that children cancers are not oftenly, treated in the same way as adult cancers. And pediatric oncology is a medical specialty focused on the care of, children with cancer specifically, right? So what are the effective treatments available only for children?
I think, Nini, this is a very pertinent question, because a child is not a young, miniaturized adult. And as we've said, it's very complex. It is extraordinarily challenging to meet the needs of our very, very, imbalanced and population. The pathology services here become very, very critical, because we have an onus of giving every child a correct diagnosis. We have many ancillary tools, and we should upfront use them to give this child a fighting chance to live.
That's true, and that's wonderfully put as well. Having said that, from your personal opinion or from your end, what do you think? How can one reduce the risk of cancer in childhood? Because, for adults, we can say is don't smoke, lead a healthy lifestyle, etc. For children in particular, is there something that the parents can keep in mind?
If they have a genetic predilection for cancer, they can definitely check and grow. But leukemias, radiation is one sort of definite factor. So we can't do anything, when they're disasters. Like we know Chernobyl resulted in a whole lot of childhood cancers, especially thyroid cancer. So these are uncontrollable. But I think one can have a high index of suspicion if there is a familial type of cancer. Otherwise, I think the most important thing is to trust the multidisciplinary team. And actually, one can't predict which child will result with a childhood cancer. And these leukemias, lymphomas, they form a big group, as well as suddenly you'll see eye tumors. So those are retinoblastomas. The mother will see some alteration, bring the child. She'll find a lump in the abdomen, bring the child. So actually the mother is the one who examines the child daily. So she's the only one who can see for early signs and bring the child. But there's, as you said, pollution. We cannot control pollution. We cannot control passive smoking. So what do we say we want a child to be given all these healthy options.
Well, I think this has been very, very insightful, Doctor. Thank you so much for joining us today and sharing your valuable insights for all the viewers.
I hope every child has a safe future. Thank you, Vinny, so much.
Yeah, we all hope so. Thank you. Thank you so much for joining.